Let's go ahead and begin. Just a quick introduction of me. Each day I've put up a different photo of me, but I was a middle school health education teacher in Portland Public Schools in Oregon. I actually grew up on the East Coast and ended up in Oregon. I went to the Oregon Department of Ed for a few years to do some state level health education work. And then 14 years ago started my my business, my consulting business. So I work to create healthy schools and environments around the country. I love it. I'm obviously really passionate about it. I don't just do curriculum and instruction work. I do a lot of whole child work, so broader school health policy work, staff wellness and promotion, and some public health partnership work as well. And each day I've put up a different photo just so you can get to know me a little bit more, because it's just so odd to train people virtually. But this is a photo of September 2013, the last day of my 90-day bicycle journey across the United States. Some of you know that I took that. You were following along at the time. And when I was 15 years old, I told my parents I would bike across the US one day. And at 38 years old, I accomplished that dream. And I love that photo because it just really shows the expression on my face when I completed a life goal. And I talk about my journey in my Do Something Extraordinary keynote, which some of you have seen at State AFERDS, but the importance of goal setting. And I know it's one of our standards, but super proud of myself from 2013. And I've been daydreaming about doing it again, but taking more time off in the middle of a career obviously is a real challenge. So that was the photo of the day for today. So I'm going to jump into talking about assessment right now. And our history has typically been teach, test, teach, test, teach, test. And, you know, overall, we still do that to an extent, and there might not be anything necessarily like bad about that, but we know a lot more about effectively assessing students' progress, both in knowledge and in skills. And we also know that getting an A on health education tests don't necessarily align to our goal of health education that we discussed on Monday. And what we said our goal is that students gain knowledge and master skills that will help them to adopt and maintain healthy lives, right? And so if that's our goal, we still have to remember that the teach, test might not always work. So for example, if you can label all of the reproductive anatomy on a diagram at 100%, that doesn't necessarily mean that you can effectively consent to being intimate with someone, or that you can use skills to say no, to not consent, or that you have the skill to ask someone else for consent. So again, when we think about how we teach, test, you know, we have to kind of think about, if this is the goal in health education, how do we assess that students can really practice and apply and use these skills when they, you know, currently and then as adults. So that's what we're really going to talk about today. So I introduced this the other day, but just to review, it's really important that we use a progression. And when I say progression, different things come to mind, obviously, but I kind of think of a roadmap in a way, a series of steps. And when you think about teaching both content, so standard 1, and skills, standards 2 through 8, there should be a progression for both. So it's important that you introduce content, allow for reinforcement of it, and allow students to have proficiency in showing you that they have knowledge gains. For skills, it's the same thing. A teacher needs to model a skill or introduce it. They want to make sure that there's opportunities for students to practice it, and then opportunities to demonstrate mastery or proficiency. And I use both mastery and proficiency because your states use all different like terms around that. So I try and kind of use both interchangeably. But what does that really mean? So let me give you an example. And the example I'm going to give is using hand washing because we know that hand washing is just such an important skill. Obviously, it's an important skill right now, but it's always an important skill. And also, we want to make sure that we're doing it throughout K-12. But I'm going to show you an example from kindergarten. So a pretty simple example. So for each slide, I'm going to show you the progression of content and then the progression of the skill. I don't want you to think that you would teach just the content in a lesson and then maybe the next day teach the skill. You can do that, but I'm also thinking that these are interchangeable or aligned. So you may teach the content and the skill kind of combined in the same lesson. So if we're going to introduce the content around hand washing, we have to talk about the functional information. And I know that Holly Alpern and Sarah Bennis in their books that I mentioned yesterday talk about functional information quite a bit, which is super important. It is not important for a 5- and 6-year-old to be able to draw a picture of what the germ that gives you a cold looks like. It is not important for them to know the names of different germs. It is probably not even important for them to understand all the diseases that they may get. That's not functional information. It's not relevant to them right now. So you have to think about, when it comes to 5- and 6-year-olds, what is the functional information for hand washing? And the reason why they need to at least have functional information is because it's really important to make the case. It's always important to make the case as to why they're learning something or practicing something. So for kindergartners, you're going to have to explain why we hand wash. You don't just say we hand wash because it feels good to run water on your hands, right? So you have to kind of think about what's the health link to continue to make the case. So I would say, and put in the chat box if you think there's more, I would say that it's pretty functional for a kindergartner to know that germs on our hands will sometimes make us sick, that hand washing removes many of the germs, that you use, when you hand wash, water, soap, and a towel. And you also talk about the length of time that you might hand wash. So I think we're at happy birthday twice. I think that's right. You hand wash before you eat, after you use the bathroom, after you sneeze or cough, after you touch something dirty, okay? So that's it, maybe. There may be 1 or 2 others, so if there are, please share. Middle school, high school, if you're teaching this, may be a little bit different. You may add other things. I don't know what, but you may add other things. So you have to really think about like what's age appropriate and like what do they need to know. And if they don't need to know it to successfully hand wash it, don't teach it because we only have so much time to teach health education. So now let's talk about what does it mean to introduce the skill of hand washing. So it might look pretty simple. Teacher should model proper hand washing. Students recite the steps or maybe draw the steps on paper. These are examples. You don't have to do this, but just examples. And then the students maybe practice hand washing. Maybe they don't actually go to a sink and do it. Maybe they pretend at the beginning, just for an introduction, okay? Now, when we go to reinforce or practice, right? That's the next stage of the progression for content. You might review it by asking students on another day about the key information that they learned. You might ask students to share with another student about how they should hand wash. So yesterday we learned about why we hand wash and how we hand wash, and I demonstrated it. Can you turn to someone else and tell them one time today that you should be hand washing? Okay, so again, you're reinforcing it. You don't just do it in one day and say, check, done. You'd never do like nutrition in one day and be like, done, or sex ed in one day and be like, I'm done. You really have to create this progression in order for students to kind of pick this stuff up. So when we move on to practice of the skill, students are spending time having opportunities to practice hand washing, all right? So you're continuing to practice it. You may even throw in, what happens if you don't have soap and water and a towel? What if you only have hand sanitizer, right? maybe not as good, but still pretty effective. So you might want to talk and introduce that piece. Or maybe you think kindergarten, let's not. Let's do that at a older age. So that's just really up to you. So if we're getting to mastery now, so again, that progression, if we're getting to mastery now, or proficiency, if we're talking about the content, maybe students are able to share when they hand wash, why it's important, how to do it. Okay, so it's just the information piece, it's just the content. They're not demonstrating to you, it's just that standard one. So they're able to somehow share. You might have them share it verbally, you might have them draw it. That's really up to you. But again, it's just that content piece. But then if we really want to encourage the skill piece, you might want to informally, I don't know at kindergarten that you would formally do this, maybe you'd use a checklist, but they're demonstrating. And here are 3 skills that they could demonstrate. The proper hand washing, they could do it, which is self-management. They could tell another student to hand wash properly, and that might be communication skills. They could draw posters of themselves hand washing and put them up around school, which would be advocacy. So this example just shows kind of from content to skill, taking hand washing, why it's really important to kind of show that progression through both the content and skills. And we should be doing something like this for every kind of concerning behavior that you want students to stop, or any healthy behavior you want them to continue or to start practicing. So maintenance or adoption of a new behavior. So think about, helmet use. Think about, for maybe high school students, how to put on a condom. Think about how to select a nutrient-rich food item off of a menu. So any of these pieces, again, think about what it looks like through your lessons to introduce, practice, and reinforce, and then kind of opportunities for mastery and proficiency. And what we're going to dig into today is a little bit more about that mastery and proficiency, because it doesn't always have to be a formal assessment. It can be very informal. It can just be an observation. It could be a self-assessment, but sometimes it is formal as well. So let's talk broadly about assessment. So assessment is a system. I believe it's not a single test in time, which is why there are there's a lot of controversy around these kind of state testing pieces, right? Like, it's good to see programs, whether they're trade schools or colleges, look at students more holistically, but we still have a lot of focus on that kind of single state test. So when you think about your health education classroom, I know some of you are still held accountable for like a health ed state test, and I hope that changes, because we really want to make sure that if our goal of health education is health literacy, that students have multiple opportunities to demonstrate both knowledge and skills. It employs multiple methods. We should be looking at progress over time. And ideally, it should be relevant. So types of assessment. Well, I'm not going to read all these. There's probably more out there, so feel free to put in the chat box if you can think of others. But we'll talk a lot about products today, like turning things in, and performances, and how to assess those. But there also is testing. So you can do true and false. You could do multiple choice or open-ended questions still. Of course, that is one type of assessment that we do. But don't forget about self-assessment, portfolios, and other options as well. So briefly, I'm going to come back to this later, but briefly, where does this fit in? Like, where does effort fit in, right? Attendance, participation, progress, those are kind of areas of health education and in any classroom that sometimes we struggle with how we assess that or how we grade students. And it might be different on everybody's report cards. So we're going to revisit that because Michelle Rawcliffe, who's on today from Woodstock, Connecticut, from the middle school, shared with me kind of like a great, well, definitely not kind of like, a great rubric around this idea of like participation and empathy and how we might score that in health education as well. So I just don't want you to forget that piece. So the first thing I want to talk about as far as kind of jumping into some tools and resources are before we jump into how to write assessments or the toolkit, what are the tools we use to analyze student work? Like, what do we use to assess student work? And sometimes it's really simple. Sometimes it's just you're walking around and you're watching students and you're observing. And it is not a grade in the grade book. It is just more of they're really picking up on what it means to use iMessages. You know, they're really picking up on that. And I'm really appreciating that. Check, move on. But sometimes it's more formal. So we're going to talk about this. And thanks to Kim O'Hara for sharing performance assessments in health ed and a list of them in the chat. Feel free to look at that Canva link and share that. So thanks, Kim from California. Appreciate that. So rubrics, let's start with rubrics. 20 years ago, when you said rubrics, not everyone knew what one was. In fact, most of the population didn't. I'm divorced now, but I was married, and he's a graphic designer, and he used to tease me because he would be like, rubric, what even is that word? And so now rubrics are widely used, and if you're not in education but you have children, you should know what a rubric is most of the time because students are talking about them. But we're going to start with rubrics, and a rubric is a set of criteria that describes levels of understanding or performance. And there's different types of rubrics. So first I want to talk about a holistic rubric. They focus on overall impressions and combines traits into each score point. And I'll show you what I mean by that. I'm going to use the term trait when it comes to kind of, how do I explain what a trait is? You'll see it when I show you the rubrics. It's like the skill that you're really looking for within this overall standard skill. So I know it's hard to explain, but I'll show you when I share it. We also have analytic rubrics, which I'll show you some examples of, and performance checklists. So today, this is for more formal assessment, right? This wouldn't be for informal. I'm going to share with you rubrics and checklists. So what I want you to think about right now, and you're welcome to put it in the chat if you want, I want you to rate your last restaurant visit. Now, at this point could have been months ago. It could be takeout that you just did to support a local restaurant. It could be fast food. It could be the fanciest restaurant you ever went to. I don't care. But think about the last restaurant that you actually think of one that you visited, because it does talk about atmosphere. And I want you to give it a score. So you can see the criteria right there. 4 is quality of food was perfect, service was friendly and attentive, atmosphere put me in a positive mood, all right? All the way down to 1, I didn't get sick. I was seated, and atmosphere, stay away, all right? So you're putting in your chats like where you were. We have a lot of 3s and 4s, so that's good to hear. You might have much better memories of restaurant visits than usual, just because you haven't been able to go to a restaurant in so long. So this is an example of a holistic rubric, okay? There aren't multiple traits. It's just having you overall rate it on a scale from 1 to 4. Some of you might do rubrics on a scale from 1 to 6. Most that I've seen nationally are 1 to 4. It's easier to score that way. But think about if you were the restaurant owner and you just got a 2. If I got a report that said you get a 2, I don't have a lot of information. I don't know if it was the quality of food, if it was the service, or if it was the atmosphere. I don't know, because it's holistic, right? It gives me some information that I can improve, but it doesn't give me a lot of information. And I'm not saying holistic rubrics are bad. They're not necessarily bad, but they are holistic. So be aware when you use them that if you have multiple indicators on a line, on a score, it might be confusing for students because they might not have all the information they need to actually progress over time. So we talked about holistic. Let's talk about analytic rubric. It focuses on different traits, and it lists indicators for those traits, and it discriminates by degree of understanding or proficiency. So let me show you an analytic one. So last restaurant visit, your scores might change because now you have to give 3 scores. You need to give a score for food, a score for service, and a score for atmosphere. So what you're seeing is 3 traits: food, service, and atmosphere. All right. You're welcome to put your scores in the chat. You don't have to do it. That's totally up to you. But think about okay? What you're going to give for food, what you're going to give for service, and what you'd give for atmosphere. Because I'm sure it's going to change. If you gave an overall 4 last time, it's quite possible that you're going to give a 3 in service this time. So I'm looking at the scores. Yeah, so many of you that had given just a 3 overall or a 4 have like 3-4-4 or 3-4-3. So just like a variety of scores. So a couple of things about this. Number one, as the scorer, so the person that went to the restaurant, so you, it's like kind of easier because it's in traits to score. But for the restaurant owner, you're giving the restaurant owner more feedback, right? So think about your students. An analytic rubric is going to give them more feedback in order for them to progress over time. So rubrics provide teachers with specific criteria, a tool for increasing consistency among other teachers if that's important, and clear targets for instruction. They provide students with clear performance targets, expectations about what is most important, and criteria for evaluating and improving their own work. Now, let's talk about performance checklists. I use performance checklists a lot as well. They tend to measure absolute standards, but you can weight criteria. Examples might be steps in refusal skills or decision making or first aid. They typically, checklists are used, they are quicker to score. If you were to see students doing a role play in your classroom and you were going to score on a checklist versus a rubric, checklists are typically quicker. So just, again, what tools should you use when? So let me give you an example of a performance checklist based on the restaurant visit. So I'll give you examples in health ed in a little bit. So based on the restaurant visit, this is just a simple yes or no, okay? So does the restaurant, did it have accessible parking? And you don't need to put this in the chat, but does it have accessible parking, clean, non-smoking, water provided, etc.? So now the performance checklist is even more specific than the rubric. And you could have put some of these things in the rubric, of course, but it's just a simple yes or no. And maybe you would rate it, see what percent yeses versus no you would get, or you get kind of a percent score. If you wanted to weight your performance checklists, here you go. So this person, whoever created the assessment or the performance checklist, weighted non-smoking as the most important. So for the restaurant owner, they know what is most important to the person who is assessing them. All right. So obviously being clean is like right after the non-smoking piece. So this would be a performance checklist. So let me give you examples related to health education. If you are not familiar with RMC Health, they are an amazing organization in Colorado. I think some of their staff are on the webinar. I have been working with RMC Health as a partner for, I don't even know. Probably when I started at Department of Education about 17 years ago. They were the professional development organization that supported a lot of the Centers for Disease Control states. They offer amazing professional development services in Colorado and across the United States. And they have many tools around health education that I love. And I do want to preface this with, they are updating these tools. So whatever I share today and tomorrow from RMC Health, they are in the process of updating them. And you're welcome to access them on their website. And I put their website there, and feel free to download whatever you want. But I want you to go back because they are going to be updating their health skills models. This is an example of one of their rubrics. This is the middle high school rubric, secondary for standard 1. So CC is kind of their abbreviation for concepts. And you can see that there are 2 traits, okay? 2 traits, connections and comprehensiveness. So when you are assessing students in hand washing at the middle school level, let's say you want to score them on 2 different traits in concepts, that they can completely and accurately describe the relationship between hand washing and health, and the comprehensiveness trait that they thoroughly cover with breadth and depth, right? So that they're talking about why they hand wash. So not just that hand washing keeps you healthy, but how to hand wash, where to hand wash, how to do it effectively. So those are the two traits and concepts. You might not score both. You might just say to students, I'm only looking at connections. But that's an example of standard one rubric. Sometimes I start with this rubric and then I customize it based on the assessment that I've developed. But it's a really great one to start with. And again, their website is there. Here's their elementary school. So what I really like is they have elementary school rubrics as well that are in first person. I sometimes I'll remove the elementary school because it could be used also for middle and high school students or for special education students. It's simplified and it is in first person. So like I would use it actually at any point. The secondary are not written in first person. So this advocacy rubric has 4 traits. So it doesn't necessarily mean that if students are doing a poster or writing a tweet to post out to advocate for wearing your seatbelt, that you have to score them in all 4 traits. That's up to you. But the traits in advocacy are, was it a health enhancing position? Was there support for your position? Were they aware of the audience? And was there conviction or passion? Which I really like about this advocacy piece. And one thing about advocacy, it's really important that if you're going to assess students in advocacy, that it's hard to score on conviction if you haven't given students a choice. If you are required to write a letter to a senator about a topic that you're not passionate about, conviction might not come through. So again, giving students choice when they're advocating would be really important. So I mentioned Michelle's rubric, and I know Michelle's on. Michelle, her name is at the top. Her tool she has offered to share, and it is in the Google folder, so you'll have access to it. So thank you so much, Michelle. She had sent it to me a few months ago to review it, and unfortunately I didn't have the time to review it, but I remembered it, and I said, Michelle, can I use this today? So you can't see all the traits. You can see, you can only see 2 of the traits. So Michelle's rubric is just flipped, so the numbers are at the top and the traits are on the side. So just, people develop them differently. And she has, the traits are patience, respect, integrity, determination, and empathy, and has a score from 1 to 4 for each. And if I'm correct, I think that Michelle developed this and then had students provide input too, because she had to send me an updated version this week because students provided input. So just an awesome rubric to show, going back to kind of the effort piece. And if you ask me, these are traits that we hope to see when we talk about being citizen ready, or post K-12 that we'd love to see in all humans. So just an awesome rubric to share with all of you. I'm super excited about it. So before, the next one I have, this is just an example that I did for New York City. This is for 4th grade. Students are writing a letter. They're learning about when people are different from you, not to bully them. And this is specifically around HIV for their HIV work. And it talks about the way that I did it is I combined the rubric with concepts and advocacy. So we have concepts on the left side and then a skill on the right side, just to make it really simple for a 4th grade teacher. And so what you'll see is that they need to know some content around disease prevention and bullying. And then on the right, just very simple, like I'm using words that show that I strongly believe. And then also I know that the letter that I'm writing will appeal to a friend. So that's the audience awareness piece. So again, just like really, really simple scoring rubric for a 4th grade teacher. So before I go to the second one, this is the one I thought was next. I'm laughing because some of you that know me well, I'm a little bit obsessed about writing rubrics. I write them for everyday life often, and my family makes a lot of fun of me about them, but I think they're awesome. And I tried to go through them, but they're all either really personal or not appropriate to share. So I'm not going to share a very personal one. I'm going to share one that I developed for my logo, for my work. But I've developed them for like finding a good Cheers bar in your neighborhood. For finding a good gym. I've developed one for me and my partner when he and I go on vacation. I've developed rubrics for our vacations. So I'm a little bit nerdy about it. But I did want to share one with you that I developed when I was working with my graphic designer around art directing her to develop my new logo. Okay, so for Care and Guidance. So this is what I came up with. So you see the logo on the left-hand side. So graphic designers don't necessarily use rubrics. Maybe they do now, more now, but I was explaining to her that I think it would be helpful if we did this. And it was like, awesome. So I wanted to demonstrate guidance. So cairn guidance, if you know what a cairn is or a cairn, it's a pile of rocks that leads or guides the way on a hike. And, I moved to Kentucky from Oregon, where a lot of times you're hiking above tree line. So people pile rocks. And now that I moved to Kentucky, actually people pile rocks on our mountain bike trails as well. But they're called cairns or cairns. And so when we were trying to, I knew that my business name was, I was going to be Cairn Guidance. When we were looking at kind of developing the logo, I wanted to make sure that the logo showed guidance, health, innovation, multifaceted business, and I wanted my design to have freshness, color, and balance. And so I developed this to come off of my logo. So I know it's not related to health education, but again, using rubrics really allow people to kind of not just assess how they're doing, but understand what you're asking for, right? So if I can come up with a good personal rubric, I'll send it out to all of you. Maybe I'll think of one of how to be healthy at home during COVID or something, because I do really love creating them. And I do want to say, if you live with a partner, they are totally worth developing with your partner, because they help with communication, how to have intimacy. There's like all different ways to come up with rubrics. So I hope you have fun with that. And I would love to develop, by the way, I know I'm off topic, but I'd love to develop a rational rubric website where people can go and develop their own rubrics, but in all my spare time. So let's move on to performance. I'm seeing people post, can it help a partner do the dishes? That would be a good one. So let's move on to performance checklist related to health ed, because the performance checklist that I showed you before were related to the restaurant example. So performance checklist to assess student learning, here's one for interpersonal communication. Let's say you're looking at a role play among students, even maybe not in front of the whole class, but maybe a group of them, or they're scoring themselves. Negotiation and conflict management skills are not going to be scored for this one because there's no points for it, but this is really based on refusal skills. So you can kind of see what we're scoring at this point in time. And again, it could just be a group of students practicing role playing and one person is assessing while watching. It could be students in front of the room. It could be that they have to write out a role play, but then they have to checklist to make sure that there's respectful tone in there. So again, just different ways to assess student learning. Here's another one on decision making. You can use rubrics for decision making, but just again, simple, yes, no. Did the student identify a situation? Are there alternative courses of action? Which one are they going to pick? What are the negative and positive consequences? And then what was the actual decision that they're going to make? And was it a health promoting one? Okay. So now that we've talked about all the tools, the rubrics and the performance checklists, how do you write a well-written prompt? And this is if you were to do more of a formal assessment again. So a lot of people ask, how do you write these formal assessments in ways that are engaging and relevant? And I had access to, RMC had one from years ago. It was probably almost 20 years ago. And a couple of other organizations had really good performance assessment toolkits, but they were older. And so we wanted to kind of compile what we knew about performance assessment writing. And Jessica Napier, who's in Lee County in Kentucky, she is Southern District Teacher of the Year this year. She and I have worked together on this performance assessment toolkit. So you were the first people that will publicly see this performance assessment toolkit. So I'm super excited to share it today. It's also in the Google folder. It is also on our website. I'm going to show you that in a minute. And it's a draft. It's just in PDF. So I would love any feedback you have, any technology you have that's missing. Please write me. I would be more than happy to add more to this performance assessment toolkit. This is a work in progress. So what I'm going to do right now is I'm going to bring us to our site. So when you click on that slide, so this is my website. Actually, if you go home, this is our site. And where I'm going right now is to resources and projects. Okay, I just want to make sure you're all looking at the same thing. It looks like you are. Here's our Get in Touch button. So if you want to add yourself to the newsletter, that's where you go. So if you go to Resources and Projects, we have a variety of different tools. I'm going to talk about Axe and Dove tomorrow. But if you go all the way down to the bottom on Other, and you click on that, we have a few documents at the top, but here's our Performance Assessment Toolkit. And if you click here, it comes up, and you're more than welcome to download it. So I'm going to bring you through it. Instead of doing screenshots, I just think it would be easier to bring you through it. Again, this would be easier. This is, for more of a formal assessment and writing a prompt. And I'm going to show you some prompts after I bring you through the toolkit. So for those of you that are super creative, you might not need a toolkit. I know that when I write assessments for curriculum, I need a toolkit to help with creativity. I need words that trigger creativity, because sometimes I get stuck. So I bring you through a variety of steps basically in the toolkit. So the first step is to figure out what the student task is, right? So it could be a goal, it could be a mission, it could be a challenge, it could be an obstacle. So there are some prompts at the top for step 1. And then there's just this whole list of verbs of like what they might do. They might argue, they might devise, they might invent, they might relate. So thinking about, what might they do, and really kind of thinking about their task at hand. And it could be really simple, or it could be much more complicated. Could be in groups, it could be alone individually. The next piece would be their role, right? So who are they? What have they been asked to do? What is their career? And so we've updated this. I love Uber driver. Like, I could see an assessment written like, you're an Uber driver and you just picked up people at the airport and they are looking for a nutrient-rich restaurant in your community that has nutrient-rich food. I don't know, but come up with stuff that's creative. Cruise ship captain right now probably wouldn't use that one, but movie director, gamer, if you have more ideas for these, send them to me and we will add them. But sometimes when I'm thinking about writing something, these lists really help me be a little bit more creative. Who's the audience? Similar list, probably. I think it's the same list. So instead of you being an artist, maybe you're you, but you're talking to the media, or you have to present to Congress, or so it's your audience that you need creativity for. Step 4 is what's the context, all right? So using things that are relevant to them, familiar places or businesses, real situations. So the challenge involves, or your opportunity is to, etc. So that's what you wanna do for step 4. Your product, so what they turn in, they need to know what they're turning in. Is it written, oral, or visual? And we just listed as many things as we could kind of think about. Are they doing a wellness plan and submitting it to you? Are they doing a tweet, putting it on social media? Are they collecting data and creating a bar graph? So what are they doing? And here are just some options. And then you have to define what the success criteria is. So in order for you to be successful, this is what I need. So you may give exemplars. You may say a successful result would mean that you list 4 nutrient-rich snacks that you have in your cupboard right now, whatever. But the more specific you are, the more successful students will be. If you just have them list, list something you like to do when you want to practice mindfulness, instead of list 3 things to do during mindfulness. It's very specific. So the more specific you are, the higher quality of work you'll get. So it kind of goes through and tells you to identify the concept or skills. Again, you can take these from the HECAT, you can take them from your local standards, you can take them from the national standards or national sexuality education standards. We'll talk about that tool tomorrow. And then again, are you going to use an analytic rubric, a holistic, or a performance checklist, or none of the above, because it just doesn't resonate with that specific prompt? That's fine. Then we did a page on incorporating technology. So again, students might, create a Powtoon or use Flipgrid. They might develop slides or a Prezi. So anyone that is asterisk is free or has a free version. If you have more ideas that you'd like to add, again, please email me, info@Karen Guidance or Jess@Karen Guidance, and let us know as you look through this, because I would love for this list to be as long as it needs to be. And then here's a template. There's different templates out there. You'll see on my slides, I have other templates that have examples that I'll show you for the prompts. But overall, here's a template. If you like it, use it. If you don't, that's fine. And then I know this is on the side. I'm like turning my head as I look at this. Here are just examples, because I am such a concrete learner. I am a person that needs to see trees before the forest, where some of you are like, oh, great, this assessment toolkit's great. I can run with this now. I'm one of those people that needs to see, again, the trees before the forest. So we put in examples, elementary conflict resolution, and then a nutrition one for middle school, and then there's a high school one around sexual violence prevention. So again, it just shows how the template is used, and that is the toolkit that I'm so excited to share for the first time. So I'm going to toggle over here and go back to my PowerPoint. Here are some examples of performance assessments. So this one is taken from my Health Literacy for Life website, where I'm developing a free curriculum that I only have 1 unit in high school done and have for 2 years because I've been so busy. But the idea is that the units are based in skills, not content. So this is the assessment for high school for the unit of analyzing influences. And there were 3 content areas embedded in: nutrition, violence, and alcohol, tobacco, and other drug use. So my lessons, there are lessons, and it's the website is in the notes of this slide. It's Health Literacy #4 Life. And it's an example, create a document that shows they're taking social media to show how people are influenced, both internally and externally, and positively and negatively. And then on that website, I also have exemplars. So there's just one example of a prompt. Here's another one. This is from a teacher in Oregon who I know really well, who always shares stuff with me on advocacy. The top advertising company in the nation has hired you. You need to create an advocacy project. These students on the left created an Instagram site and started to post how to find a trusted adult around suicide. So again, examples of something that is just way more engaging and relevant than just taking a test on writing down the 5 signs of suicide in a box. How do you promote this? How can you kind of do a t-shirt or social media page, or this teacher allows them to do their own project. Here's a middle school example where students, you are just a student, so you're yourself. And during the school year, there's fundraisers that are selling a variety of competitive foods, we call them, and they're not all nutrient rich. So, your challenge is to convince the school community to replace the fundraising items with nutrient rich snacks or non-food items. Your task is to write an article for the school newspaper. And it's advocacy. So they need to have a health enhancing position. That's what they're scored on. You can see at the bottom. They don't have to, it's not being scored on conviction or audience awareness, it doesn't look like, because step 3, but still they have to have a health enhancing position. And then here's my last example. This is elementary, secret agent. You're a secret agent assigned to detect messages in your community. It's probably upper elementary, around tobacco. So, what are the messages around your community that are encouraging people to smoke? Or you could add, e-cigs as well. And they have to describe the message, where they found a message that's promoting tobacco use and how the message encouraged smoking, and share what you believe is false about the message. So it's a little bit of that analyzing influences piece. So again, how do we write performance assessments that are engaging and relevant and fun? And I really hope that the combination today of the performance assessment toolkit can give you ideas of even more assessments. I also know that Shape America, there's a group of us that were part of the Health Education Assessment Project that have been looking at old assessments that were developed years ago by CCSSO, which is an organization, a national organization, and we've been kind of updating assessments. And I think they've rolled out. I'm not exactly sure. If you're a member of Shape America, you have access to assessments. Some of them are just multiple choice to create a test. Some of them are more specific prompts as well. But I have tons of these prompts. So if there's a specific area that you're struggling with or stuck, let me know. My Kentucky peers here, there's a group of us in Kentucky Shape. We have a health education cadre now that I'm helping lead voluntarily, and there's 8 of us teachers on it, and we share. So a teacher in Lexington will share a performance assessment prompt that they wrote for their middle school teachers, and they'll share it with us, and then we'll make comments to revise it, or we'll share it with other people. So it's just really nice to kind of have well-written assessments and for health education. So again, going back to what I talked about yesterday, if you weren't on yesterday, we talked about, the HECAT and developing a good unit and making sure that you kind of have the scope and sequence and the knowledge and skill expectations. And then the next step is to develop an assessment, which is why I wanted to talk about assessment today. The next step after you develop these prompts, or this performance assessment prompt, is to develop your lessons. So it's that backwards design. If I'm looking at the secret agent one right now, and this is where I want my students to go at the end of my unit, now I develop my lessons to lead to this as my performance assessment prompt at the end. So that's really kind of the journey that we take. So that wraps up today's content on assessing students in health education, rubrics and performance checklists. Tomorrow, we're going to be talking about free, no-cost tools to support skills-based health education, and some low-cost as well. What I'd love for you to do before you leave is in the chat box, if there are any free or low-cost resources or documents, like the performance template that I shared today, guidance tools like the health education standards, curriculum or programs that are no or low cost, or social media like who to follow, Twitter, hashtags, put them in this Zoom chat, because I'll add them tomorrow. I'll take a peek at them and I'll add them to my Symbaloo. I just would hate tomorrow to be sharing, and I know that tons of people will continue to share tomorrow, but if you can share today, I'll try and incorporate them all in my Symbaloo page today, tonight when I finish my Symbaloo page up, versus tomorrow. I'll continue to add, but I'm trying to kind of manage that. There's so much out there that I don't know about. I see 3Rs. 3Rs is already in there, so thanks for sharing that. And then who to follow, put it in the chat right now, and I'll add these tomorrow. So thank you for doing that. I do look at the chats after. I am going to be working on a next webinar series, probably in a couple of weeks, so stay tuned. I encourage you to go to the Care and Guidance site, the Get in Touch page, sign up for our newsletter so that we'll send out when the new series will be. It's not specific to curriculum instruction. It will be broader on the whole child work, but super excited for that series as well. And then final slide, just YouTube channel. Here's your QR code. It won't be uploaded until probably in about an hour. We're smoking ribs today, so I have been instructed to throw more charcoal on the grill after I finish this, since my family is all out bike riding at the lake. Lucky them. And then Google folder with materials. Everything is in there already now, so you're welcome to use the QR code. Also, I will send an email later today to all of you that are registered, whether you were on today or not, that has all of these URLs and documents hyperlinked into the email so that you have everything. So again, last chance. Feel free to put your Twitter handle. I see Scott adding his and Andy's Carmel Health. So I'm going to add you all to the Symbaloo for sure. You're all great people to follow and have been super involved in the health education advocacy field and sharing resources. So share what you want, continue to do it in the Zoom. I'm not going to close this webinar for about 5 to 10 minutes. So if you keep adding to chat, that's great. If there's any free curriculum, low-cost curriculum that you use, please share it. And again, I'll add it as well. So thanks, everybody. Have a great afternoon. There are about 150 of you on today. I really appreciate it. And hopefully we'll see you tomorrow.